Dr. Scott Sears, good to have you back here in studio with us.
Yeah, it's nice to be here. It's good to see you, Aaron.
Getting some good golf in this spring, at least the weather.
I actually have,
decent.
because there hasn't been a lot of other things that you can actually go do, but you can socially distance on the golf course, still have a good time. So I and my kids have been going out quite a bit.
I finally got out yesterday, and I love these new rules because, I got a bad back. It's like now I don't have to pick up the pin. I can just leave the pin in place, clunk, hit it. Oh, sorry. That's still good, right?
I think it depends on what group you're playing with.
Exactly, yeah. Well, I don't take golf too seriously because I'm not good enough to take it too, but I have a good time. I finally got out for like the first time in over a year. But you got a pileup of interesting information to share with us here this morning. But you love taking the phone calls. So even though you've got a bunch of information to share, we want to remind people, call in because he likes taking your phone calls about any medical question or whatever you have. So the number, 406-294-0970. What have you been learning that's not COVID-19 related over the past few weeks that maybe hasn't gotten the attention in the national media?
Yeah, and just to tee you, I will throw out just a couple of questions that people ask that some of these recent studies have shown, and then after the breaks we can hit them and mix them in with the answers to people's questions if they call in. So questions like, what time of day should I take my blood pressure medications? There's new data that surprises some folks about that. How much ibuprofen or Advil can I take at one time, if I really need to treat pain? Why did my doctor not do an x-ray to check if I had pneumonia? How do I know if I'm having allergies or if I have COVID? So I'm sneezing in Albertsons, everybody's giving me this stink eye, and I'm like, look, I have hay fever. The pollen counts are really high. So how do I know the difference between allergies and COVID? When do I need to fast to get my blood work at the doctor's office? I'm going in and my appointment's at 3 p.m. Should I cancel that appointment because I can't fast that long? And the most important one, I think, is the most important symptoms are not sharing with their doctor, that they go to the doctor intending to share, show up, don't talk about it, leave regretting having not talked about it. What are those symptoms and why are they not sharing? So those are some of the great things we can talk about today.
Well, and kind of tied in with Tim and Savage's question is, because we're going to talk about a lot of stuff that's not necessarily COVID-19 related, but when we think about the isolation and the social distancing, there are side effects to that. There are serious side effects. So we'll get into a little bit of that, I think, too.
Absolutely. It all ties together.
Dr. Sears, that whole list that you went through, where should we start? I almost think do you take it in the morning or do you take it in the evening is a good question to start.
Yeah, great question, which is blood pressure medicine. So many Americans have high blood pressure, and so many of them have to take blood pressure medications, and they think, well, when I'm up during the day and I'm active, that's when my blood pressure is highest. I should take my pills in the morning. Or they're just in the habit of, I wake up, I take my pills, I eat breakfast, that's my routine. Well, they finally did a study that looked at the time that you actually take your blood pressure pills last year, and it ends up they randomized two groups, one to take it at bedtime, one to take it when they first wake up in the morning. Interestingly, the group who took their blood pressure medications at bedtime had a much lower risk of heart attacks and strokes, much fewer side effects of their medications. And so there is good evidence out there now that really, if you're taking a once daily blood pressure medication, should take it at bedtime. Now, obviously, if you're out there listening, it's important to talk to your doctor. You want to make sure you're not taking it together with another pill that interacts with it. But by and large, you should be taking your blood pressure medication at bedtime, and you have a much lower risk of heart attacks.
And it kind of makes sense to me, I guess, because you think about it, your body at night, especially if you're getting good sleep, or that's when your body is really preparing and resting and recovering, right?
And revving up for the next day. So about 2, 3, 4 o'clock in the morning, which is a common time we see heart attack patients come in, their body just subconsciously starts to rev up, blood pressure starts to amp up, cholesterol production goes up, or cortisol. So it makes sense. So there is some reason behind it, and now there's evidence to do it.
It's kind of like hydrating the night before. If I'm going to go for a big run tomorrow morning, well, I'm not going to wait until 7 o'clock in the morning to drink water. I need to hydrate the day before so my body's ready when it needs it. That's probably a similar.
Yeah, so a really good tidbit out there for people to know. Most people are taking their medications wrong.
Yeah, very interesting. All right, well, let's jump into the phone calls. Let's see. Bob in Belgrade, listening to 1450 KMMS. Bob, good to hear from you. Did you have a quick question or comment?
Yeah, quick question. So I hear people can be walking around with the COVID-19 virus asymptomatically. They don't express any symptoms at all. So the question I have is, how long can a person be asymptomatic? Does it run its regular course of if you 2 weeks or whatever it is for full-blown evidence of it? I hear from the health department here locally that you have to believe that anybody could be walking around with the virus and you wouldn't know it because they don't show symptoms. And I'd say, well, yeah, but for how long?
A good point. Yeah, Dr. Sears, your thoughts. Thanks, Bob.
Yeah, a great question that I wish we had an accurate answer for, right? But I mean, it is really difficult to say how long is someone going to stay asymptomatic before they develop symptoms. What we do know is that the majority of patients are showing symptoms within 4 to 6 days of being able to have the disease. We also know that the infective period is highest between about 24 hours when you develop symptoms and about 4 to 5 days after you develop symptoms. That's your peak risk of infecting somebody else. It doesn't mean that you can't infect someone else outside that window, but the majority, the highest risk is that window, 24 to 48 hours before you develop symptoms to 4 to 5 days after you develop symptoms. We also know that the tests that we're running are most predictive of a positive result after a couple of days of symptoms. So, there's a lot of initiative right now. We should test everybody, whether or not you have symptoms. Let's just test everybody and see if you have it. The test actually isn't as accurate in patients who don't have symptoms. And so that's why this question is so difficult to answer. We don't know. But by and large, you should be most worried about people 24 hours before they develop symptoms and 4 days afterwards. And if you were around someone 24 hours ago and they still don't have symptoms, the risk of you getting an infection from them goes down dramatically. It's not zero, but it goes down dramatically.
That kind of ties in with Tim and Savage's question about are we diminishing our immune systems due to isolation and feverishly cleaning everything that we might be exposed to? Are we potentially diminishing our immune system?
Yeah, are there unintended consequences that's actually setting us up for failure? And there's actually some data on this, but not necessarily with COVID. But we do have some data that little kids that are raised with pets have a little bit stronger immune system later on.
Because they get exposed to stuff earlier.
Because they get exposed to stuff earlier. Kids that are homeschooling versus kids that are exposed out in public schools, right? Their immune system, you're not exposed to as many diseases out there, so your immune system doesn't develop antibodies against a lot of these diseases. So many of us are exposed to so many diseases that we're not even aware of that we develop antibodies for. Our body just does this in the background. So yeah, if we socially isolate people forever, is there going to be some other downstream impact? Likely there is. The other way that it can impact us, besides just exposure to diseases and development of antibodies, is frankly, we know that patients with depression, isolationism, and anxiety have suppressed immune systems and have an inability to fight off infections as well as someone else. They also have a higher risk of heart attacks and strokes. And so it is important that folks have some sort of interaction. That doesn't mean that you have to allow people in huge congregations or you have to have a party of 200 people, but people have to be intentional about interacting with other folks. There's so much technology they can use. Physical distancing does not mean social isolation. None of the public health officials are saying you need to socially isolate yourself. They're saying you need to socially distance yourself. So people need to distance themselves and not isolate themselves. Continue to interact with folks.
Let's talk about how isolation from COVID-19 is potentially screwing up your sex life. All right, that could have been our teaser right before the break there, right? Dr. Scott Sears. Yeah, apparently people don't want to ask their doctor these types of questions sometimes because they're too nervous to ask them. But talking about the side effects of COVID-19 isolation, apparently sexual dysfunction is one of them.
Yeah, and this goes back to a study that started even before COVID came out, which is why do people go to the doctor, talk about something unrelated to why they went there in the first place, and then leave regretting not talking about what they went there for in the first place? The 4 symptoms, they did a big study. They asked people, why are you going? What are the most important things? And then they surveyed them as they left. Did you talk about those things? The 4 symptoms that they talked about the least, number 1, depression, number 2, anxiety, number 3, sexual dysfunction, and number 4, relationship difficulties. It's like they show up to the doctor with the intention of finally talking about this with someone who potentially could help them or at least connect them with resources to help them. And then they end up shooting the breeze about something else, leaving the appointment and then feeling disappointed, like, I'm still stuck feeling depressed. I'm still stuck having decreased sexual desire or decreased sexual function. I'm still stuck with a relationship difficulty, and I was too embarrassed to bring it up. And COVID has highlighted that.
Especially in Montana, where, at least from a suicide standpoint, we've got some of the worst numbers in the country.
And it's gone up during COVID. So COVID has increased people's experiencing symptoms of depression, anxiety, relationship difficulties, and sexual dysfunction. Because sexual dysfunction, the most common reason people have sexual dysfunction is depression and anxiety and relationship difficulties. So it makes sense as COVID has increased depression, anxiety, and relationship difficulties. Of course, it's caused sexual dysfunction. And then people think, well, I'm just getting older or whatever. And they go in and they talk about something else because they get there and they're embarrassed to talk about it. There are things that can be done. We actually at St. Vincent, we screen 100% of our patients in our primary care clinics for symptoms of depression and anxiety when you show up. You fill out a piece of paper. It's non-confrontational. You don't have to admit it to anybody. And we screen for those disorders. And we need to do a better job of asking people about relationship difficulties and sexual dysfunction, because when you think about the downstream effects on their health, what does it lead to? It leads to separation in families, family conflict. It leads to suicide. And those numbers have all gone up during COVID. So folks out there listening, don't ignore those symptoms. And when you go in, don't suppress them. Share them openly. It's a very non-judgmental setting. Lots of things we can do to help those things. And so bring it up instead of hiding it.
Yeah. So, fascinating tie-in with, the previous question from Tim and Savage as well about just potential side effects from some of the COVID-19 measures out there. Some of the other interesting studies that you've been reading, the blood pressure medication one was very interesting. Hey, take it at night instead of in the morning if your doctor says that works with your plan and everything else you're on, et cetera. Advil. I was joking during the break, and I know I've got some military friends listening to the show, some fellow veterans listening to the show right now. They, in the Army, especially in the infantry, you got sore back, you got sore everything because you got a massive ruck on your back, then you're marching forever. So, hey, get some Ranger candy from the medic, 800 milligram Motrin, but you've actually seen some studies now that say actually more is not necessarily better.
Yeah, and it's even something that as I went through medical training, I was taught also, even as a patient, as I went through training, I was a migraine patient, still get migraines, and I was told very early on, your cocktail needs to be 800 milligrams of ibuprofen and a can of Diet Coke with some caffeine in it, and that's a great treatment for migraines. Well, after a while, I got tired of taking 800 milligrams, 4 Advil, at a time, and I'm like, well, I'll try 3. It worked just as well. And so recently there's been a couple of studies in 2019. One was trauma victims in the ER that went in with actual trauma pain, and they randomized them into 2 groups. One group just took 400 milligrams of Advil, which is just 2 over-the-counter Advil pills, and the other groups took either 600 or 800, much higher doses. No difference in the pain effect. Another study about chronic arthritis pain, where commonly we as physicians have been trained to teach people, hey, the higher doses of ibuprofen are an anti-inflammatory dose, and so you need to treat the inflammation. Well, in chronic osteoarthritis with chronic inflammatory pain, 800 milligrams ibuprofen didn't show any increased benefit over 400. So what I encourage people, don't think that more is always better. More definitely causes more ulcers and more side effects, higher blood pressure, which is another common side effect of Advil. So try with 400 or just 2 over-the-counter Advil and see how you do.
It reminded me of the other tip. I loved it when you told us this. I've been telling some friends about it. They're like, really? The doctor says that if I just run 10 minutes a week, that I'll get the full benefits out of running just by 10 minutes a week. I don't have to go run for hours. Yeah, just get 10 minutes. Now, you got to do other exercise. But for running, especially if you got a bad back or knees or whatever, 10 minutes.
I still have a medical assistant who tells me, I go running and I stop at 10 minutes because I listen to that radio show. And I'm like, well, more is better with running, but at least 10 minutes.
There you go. Yep. All right, I'm done. Back to the restaurant for the mac and cheese with the no. All right. Let's see. Phone number for you. If you got a question, you want to jump in, you got a medical question or a question about the business of healthcare, Dr. Sears, St. Vincent Healthcare can answer, really. He takes any question under the sun. What are some of the other studies you've been hearing about? What else is piled up out there?
So a really good one, which is how long do my cold symptoms last? This is a big deal when COVID comes around, and school comes around again in the winter. But, people freak out when their symptoms go on more than 3 or 4 days. Their kid has a runny nose and it's keeping them up at night. The common cold, lasts anywhere between 9 and 23 days. And people don't realize how long the common cold can actually last. So it's common for people to have sniffles. And that brings up the other question, which is, how do I know if I have sniffles because I have a cold, because I have allergies, or because I have COVID? Because it has been shown now that people can have some runny nose symptoms with COVID. But the truth of it is the most common symptoms with COVID are still fevers, cough, shortness of breath, loss of the sense of taste or smell, right? or a generalized feeling of malaise, kind of that flu-like symptom with a high fever. There are some other symptoms. I mean, you can certainly have a runny nose. You can have some ear pain. You can have a sore throat. Those are much less common with COVID, much more common with the common cold, and much more common with allergies. So our pollen counts are skyrocketing right now. People are showing up to the grocery store. They're runny nose. They're sneezing. They're coughing. And everybody's giving them the evil eye. It's like putting a scarlet letter on them and throwing them out and tarring, and feathering them. But
which is a good point to where, hey, if you have allergies, you're somebody who definitely would want to wear a mask because you might be sneezing and you might be doing that.
And if you're sneezing and generating sneezing and you're one of these asymptomatic folks with COVID, your risk of spreading is going to be higher because you're expectorating secretion. So, and it's important not to ignore your symptoms. There's great treatments, nasal sprays, over-the-counter allergy medications, hot, steamy showers.
I remember when you told me about the blue lid.
Yeah, blue cap versus green cap
on the Flonase. So if you get really dried out from, allergies in your nose and your eyes, take the blue one, and it's not alcohol-based.
That's right. The blue cap is water-based, and so it tends to be more lubricating. If you have a really runny nose and you want to dry yourself out, use the green one because it's an alcohol base. Great nasal sprays, great treatments for allergies. Stop living in misery just because the pollen counts are high. There are things that we can do to help.
Yeah, just ask your doctor about it. Another one of those reminders. Start taking notes, throw it in your calendar, whatever. Let's see. Oh, the one about X-rays and pneumonia.
Another common one. People show up to the doctor demanding an X-ray, say, I swear I have pneumonia. I think I need an X-ray. Well, great studies have been published, again, just in 2019 that show the most predictive findings for pneumonia are, number one, you have abnormal vital signs, and number two, you have an abnormal lung exam when your doctor listens to your lungs. So a trained professional listening to your lungs. People who had normal vital signs and a normal lung exam on a physical examination had a risk of 4 out of 1,000 of having pneumonia. And so if you go in and your doctor does a careful exam of your lungs, looks at your vital signs and says, I don't think you have pneumonia, I don't think we need to do an X-ray, you should believe them. Because the more X-rays you get, the more radiation you get, certainly to the chest area. Women with breasts, we know that radiation increases risk of breast cancer. People who demand constant X-rays and CT scans really don't know that they're increasing their risk of other things decades down the road. And so we're trying to avoid studies when we don't need them. So trust your doctor when they have normal vital signs, normal lung exam in their office. Your likelihood of having pneumonia is 4 in 1,000.
All right, looks like we got somebody calling in, so we'll try to get to them real quick because I know we only got a couple of minutes left here while we wait to get them on the show here. What's the good news over the last couple of weeks?
Obviously the good news is we're opening back up. We're not seeing a huge spike in COVID. We are testing a ton of people. Everybody going in for a procedure is getting tested. Very few positive tests. And so that's the great news. People are getting out. They're being physically active. They're getting back to their lives. And that will cause depression, anxiety, relationship dysfunctions to go down. So there's a lot of bright news going around.
Yeah, definitely. Yeah, because I know there were a number of people who were afraid that, we open things up, we're going to see this massive spike, and fortunately we haven't had that. All right, just a couple minutes to go. Darla in Billings, did you have a quick question or comment for Dr. Sears?
Yes, I did. I would like to know the thoughts on taking Humira for severe rheumatoid arthritis and if there's risks or, what the danger could be.
Boy, what a great question
thanks,
in the sense of all this press going out there about COVID, right? Taking hydroxychloroquine or azithromycin or all these other medicines. There are always side effects to medications. To answer your specific question, Humira, for those that don't know, is a very potent medication that treats rheumatoid arthritis. Rheumatoid arthritis is an arthritis that's caused by our own immune system. It's when our immune system attacks our own joints. The way to treat it is to shut off our immune system. The best medications are the most powerful ones to shut off the immune system. If you shut off the immune system too much, you can predispose yourself to infection. So Humira does have side effects. It tends to be that you're at higher risk of infections, at higher risk of complications of infections. And so there are tests that we run on our patients who are on it to make sure, right, that they don't have any suppressed infection before they start it, and then we monitor them very closely on it. So Humira, the biggest side effects are a suppressed immune system with infections, but All medications have side effects. Important to talk to your doctor about it, understand them, watch for them.
And somebody in that position, if your doctor says yes, take it because you have to for A, B, and C reasons, but they're probably also going to recommend that you definitely remain isolated, shelter,
Absolutely. It's always when
yourself.
the benefits outweigh the risks, that's when we use the medications.
All right. Dr. Scott Sears, always a pleasure. Thanks so much for being with us once again.
Hey, thanks, Aaron.